If you're over 60, you've probably been told to take calcium to protect your bones, to prevent fractures. But what if the very supplement you trust is quietly doing more harm than good? Doctors and researchers have uncovered troubling facts about how calcium behaves in the aging body. It doesn't always go to your bones. Sometimes it ends up where it shouldn't: your arteries, your kidneys, even your heart. Before you take another tablet, understand the hidden risks no one warned you about. Your body deserves the truth, and your health may depend on what you learn today. If you or someone you love is taking calcium supplements, don't skip this. Hit the subscribe button and share your experience in the comments. We're building a community that values truth, safety, and smarter aging. Let's take control of our health, starting with the choices we make every day. You've been told for years that calcium is good for you, that it protects your bones, that it's something you need to take after 60. And for many seniors, those little white calcium tablets have become part of the daily routine, just like brushing your teeth or taking a walk. But doctors have observed something alarming. The very supplement so often linked with strength and safety may be quietly putting your heart at risk. And the more you take, the more that risk grows. Experts explain that while calcium is vital for the body, the source matters. Calcium that comes from food, like leafy greens, seeds, or dairy, moves through the digestive process more slowly. It's absorbed at a rate the body can manage. But calcium from supplements floods the system all at once. That sudden spike can overwhelm the body's ability to process it properly. And when the body can't direct all that calcium into the bones, it starts looking for other places to store it. That's where the trouble begins. Doctors have observed that when calcium doesn't go into the bones, it can settle in the arteries. That process is called calcification. It's when calcium, instead of helping your skeleton, ends up hardening the walls of your blood vessels. Those vessels become less flexible. Blood doesn't flow as easily. Pressure builds, and in time, plaque can form around that hardened calcium. This plaque can block blood flow to the heart or brain, leading to a heart attack or stroke. Studies have shown that seniors who take high-dose calcium supplements are more likely to have signs of arterial calcification, especially those with a history of high blood pressure, kidney disease, or diabetes. And because this buildup happens silently, most people don't know it's there until something serious happens. A scan reveals narrowing, a routine checkup picks up a murmur, or worst of all, a sudden chest pain leads to the emergency room. What makes this especially concerning is that many seniors take calcium without realizing how much they're getting. Between pills, multivitamins, fortified drinks, and antacids, the total intake can rise quickly. Experts warn that the recommended upper limit for calcium from all sources is around 2,000 to 2,500 milligrams per day. But many older adults, especially those doubling up on supplements just to be safe, go far beyond that. And unlike some nutrients, excess calcium doesn't just pass through. It sticks, it builds up, and it hardens. Researchers who tracked older adults over a period of 10 years found something striking. Those who relied heavily on calcium supplements had a significantly higher risk of cardiovascular events compared to those who got their calcium mostly from food. The difference wasn't small, and it didn't matter whether or not they had a prior history of heart issues. The supplements themselves were the trigger. Doctors emphasize that this doesn't mean calcium itself is bad. Your body still needs it for bones, teeth, muscles, and nerve function. But the way you get calcium is critical. When it's introduced gradually through natural food sources, the body uses what it needs and disposes of the rest. But when it arrives in concentrated form, like a tablet, the body can't keep up. That's when calcium begins settling in soft tissues, including arteries and heart valves. Some cardiologists have even reported seeing seniors with significant coronary artery calcification who had no traditional risk factors, no high cholesterol, no smoking history, no diabetes. The one thing they had in common: long-term use of calcium supplements. For years, these pills were taken daily with good intentions, and silently, the damage accumulated. Another concern is how calcium interacts with other nutrients. For example, calcium competes with magnesium and zinc for absorption. If too much calcium is present, it can block the uptake of these other essential minerals. Magnesium, in particular, plays a key role in keeping heart rhythm stable and blood vessels relaxed. When magnesium levels fall, blood pressure rises and arrhythmias become more likely. So even if you don't feel the effects of excess calcium, it may be weakening your heart in ways you don't see. Doctors also explain that calcium overload can interfere with kidney function. The kidneys are responsible for filtering and balancing minerals in the blood. When they're flooded with calcium day after day, their filtration efficiency declines. That raises blood calcium levels further, which in turn increases vascular calcification. For seniors, especially those with already reduced kidney function, this is a dangerous cycle. Many experts now recommend that calcium supplements only be used when medically necessary, and even then, at the lowest effective dose and under careful supervision. They stress that the goal should be to get calcium from food first. Not only is it safer, but studies show food-based calcium is actually more effective at supporting bone density in the long run. Leafy greens, almonds, beans, sardines, sesame seeds, these all provide calcium in a form your body recognizes and can use properly. So why hasn't this message reached more people? Part of the reason is outdated guidance. For years, health messaging encouraged everyone over 50 to take calcium. It became automatic, unquestioned. But newer research has revealed risks that weren't fully understood before. And now, doctors are urging seniors to rethink the routine, not out of fear, but out of care, out of a desire to protect what's most valuable, your heart, your independence, your life. If calcium supplements have been part of your daily habits, this is not a reason to panic. It's a reason to pause, to talk with your healthcare provider, to ask how much calcium you're really getting and where it's coming from, to check your diet and see if you're already meeting your needs through food, to avoid layering pills that quietly add up. Your heart has worked tirelessly for you for decades. It deserves a chance to rest, repair, and remain open and strong for the years ahead. And that chance begins not just with what you add to your routine, but also with what you might need to remove. Every choice you make now can shape the quality of life you live tomorrow. Calcium matters, but where it goes matters even more. Let it support your bones without risking your heart. Let it build you up, not weigh you down. And let today be the day you take control with wisdom, care, and clarity. For many seniors, taking calcium feels like a form of protection, a way to guard against fractures, a step towards staying strong and independent. The idea is simple. Calcium builds bones, but doctors and researchers have observed something surprising. Taking calcium alone, without other essential nutrients or changes in daily habits, doesn't actually protect you the way you might believe. And the longer this false sense of security goes unchecked, the greater the risk becomes. Experts explain that bone health is about more than just calcium. Bones are living tissue, constantly breaking down and rebuilding. And this rebuilding process depends on a variety of nutrients, like vitamin D, magnesium, vitamin K2, and even protein. It also depends on movement, sunlight, and strength-bearing activity. Without these key pieces in place, calcium has nowhere meaningful to go. It moves through the system, but it doesn't lock into the bone the way it needs to. This means bones stay fragile, even when calcium levels appear normal. Studies have shown that calcium supplementation alone doesn't significantly reduce fracture rates in older adults. Researchers tracking large populations over time found that people who relied solely on calcium supplements without improving their vitamin D intake, physical activity, or diet didn't experience fewer breaks. In fact, some studies suggest the opposite, that supplements, when taken in isolation, may even lead to a sense of overconfidence. Seniors assume their bones are protected, when in reality, nothing has changed. Doctors have observed this in clinics across the country. Patients who never miss a dose of calcium yet continue to experience falls, fractures, or loss of height from spinal compression. The misunderstanding often comes from old messages. For years, seniors were told that calcium was the single most important nutrient for bone strength. But modern research paints a more complex picture. Vitamin D plays a critical role in helping the body absorb calcium. Without enough of it, calcium doesn't make it from the bloodstream into the bones. Many older adults are deficient in vitamin D, especially those who spend less time in the sun or who live in colder climates. And yet they're taking calcium daily without knowing their D levels. Experts explain that this imbalance means the calcium often ends up circulating aimlessly or settling in the wrong places, like the arteries or kidneys, without improving bone density at all. Magnesium is another missing link. It helps regulate how calcium is transported and used throughout the body. Without enough magnesium, calcium can't bind to bone tissue properly. Seniors who take large amounts of calcium without addressing magnesium levels may experience muscle cramps, heart rhythm problems, or fatigue, signs that calcium is working against them, not for them. Vitamin K2, less commonly discussed but equally essential, directs calcium to the bones and teeth while keeping it away from soft tissues. Doctors have found that seniors who lack K2 may be more likely to develop arterial calcification, even while taking calcium with the best of intentions. This highlights why isolated supplements are rarely effective. The body needs a balanced team of nutrients working together, not a single ingredient in isolation. Experts also point to the role of exercise. Bones respond to stress. They grow stronger when they're used, challenged, and loaded through resistance. Seniors who take calcium but remain inactive are missing one of the most powerful signals for bone formation. Studies show that weight-bearing activity, like walking, dancing, or light strength training, is one of the strongest predictors of long-term bone health. Calcium alone can't match the impact of movement. Nutrition, too, plays a quiet but crucial role. A diet rich in leafy greens, nuts, seeds, fish, and legumes delivers not just calcium, but the supporting cast of minerals and vitamins bones need. Doctors emphasize that the calcium in food is absorbed more slowly, used more effectively, and doesn't carry the same risks of overloading the system. Food-based calcium arrives with natural partners, fiber, enzymes, and antioxidants that help the body use it well. There's also a deeper issue with relying on supplements. It creates a passive mindset, one where health becomes something managed by pills, not lifestyle. Seniors who believe their calcium tablet is taking care of it may skip exercise, ignore diet, or neglect balance training, essential elements in preventing the very fractures they fear. This mindset can lead to more harm than good, as real prevention requires active participation. Doctors have seen this pattern over and over. Well-meaning patients who take their supplements faithfully, but suffer hip fractures after a fall, or show little improvement in bone scans year after year. What's missing is not dedication, but information. The belief that one tablet taken in isolation can replace the dynamic needs of the aging skeleton. Research from respected institutions supports this. Long-term studies have concluded that calcium alone has minimal effect on fracture prevention. Benefits are only seen when it's combined with other interventions, especially vitamin D and exercise. Without them, the promise of protection becomes an illusion, and that illusion can delay the changes that truly matter. Experts urge seniors to think of bone health as a system, not a single solution. It's about how the body moves, absorbs, uses, and maintains minerals over time. It's about balance between calcium and magnesium, between rest and activity, between supplements and lifestyle. When those pieces come together, the body responds with strength. But when calcium is taken alone, that balance is lost. This doesn't mean calcium has no place. It means it should never stand alone. Doctors recommend evaluating your whole approach to bone health, looking at sunlight, movement, protein intake, and overall resilience. A strong body depends on more than one nutrient. And a strong future depends on knowing the truth behind the labels. So if calcium has become your daily defense, ask what it's supporting. Ask if the rest of your routine is giving it direction, purpose, and partners. Because your bones are still alive, still listening, still rebuilding even now. The power to protect them isn't in a single pill. It's in the way you live, the way you move, and the way you nourish yourself every day. Let that be your foundation. Let that be your real protection, starting today. Most people think of calcium as a bone-building hero, something simple, something safe. But doctors have observed that too much calcium, especially from long-term supplement use, can quietly cause harm in a place many seniors never expect, the kidneys. And by the time symptoms show up, the damage may already be done. Experts explain that your kidneys are responsible for filtering the blood, balancing minerals, and removing waste. Every day, they sift through about 50 gallons of blood, filtering out what your body doesn't need, including excess calcium. But when calcium is taken in large amounts, especially in concentrated supplement form, the kidneys have a harder time keeping up. And over time, that overload can lead to serious complications. Studies show that high calcium intake from supplements, not food, but tablets and powders, is linked to a greater risk of kidney stones. These stones form when calcium combines with other substances in the urine like oxalate or phosphate. They create tiny crystals that can clump together into hard, painful stones. Doctors have seen countless seniors arrive at clinics with intense back pain, nausea, or blood in their urine, only to discover that a calcium supplement they believed was protecting their health was actually causing internal distress. What makes this even more dangerous is that seniors are often more vulnerable to these effects. As we age, kidney function naturally declines. The filtration rate slows. Waste products take longer to leave the body. If calcium continues entering the system in large doses, it builds up in places it shouldn't. That includes not just the urinary tract, but also the soft tissues of the kidneys themselves. Doctors have observed that this calcium buildup can lead to a condition called nephrocalcinosis, when calcium deposits begin to harden inside the kidney tissue. This doesn't just cause discomfort, it reduces the kidney's ability to function. And if left unchecked, it can lead to chronic kidney disease or even kidney failure. For seniors who are already managing high blood pressure, diabetes, or dehydration, this added burden on the kidneys can be especially harmful. Experts emphasize that hydration plays a key role in how calcium is processed. Seniors who don't drink enough water, often due to medications, reduced thirst, or bladder concerns, are more likely to form kidney stones. Water helps dilute the calcium in the urine and flush it out safely. Without enough fluids, calcium becomes concentrated. Crystals form more easily, and the risk of stone formation rises significantly. Doctors also point out another layer of risk: drug interactions. Many older adults take multiple medications each day. Some of these, like diuretics, certain blood pressure drugs, or antacids, can interfere with how calcium is absorbed and excreted. When calcium supplements are added on top of these medications, the balance is disrupted. This can result in too much calcium in the bloodstream, a condition called hypercalcemia, which places even more strain on the kidneys. Symptoms of calcium overload in the kidneys may not be obvious at first. Fatigue, muscle weakness, or mild confusion are often dismissed as part of aging. But inside the body, calcium may be silently accumulating. Over time, this can cause persistent back pain, decreased appetite, or changes in urination, signs that something deeper is wrong. By the time these symptoms appear, the kidneys may already be inflamed or impaired. Researchers have tracked large groups of seniors and found a clear trend. Those who take high doses of calcium supplements, especially without medical supervision, are more likely to experience kidney-related complications. Even moderate doses taken daily for years can tip the balance if the kidneys are already under stress. Doctors now recommend caution with long-term calcium supplementation, not just because of bones or the heart, but because of what it does. to the organs responsible for filtering and cleaning your entire system. They urge seniors to have their kidney function tested regularly and to speak with a healthcare provider before adding or continuing any calcium supplement, especially if they are taking other medications or managing chronic health conditions. Food-based calcium, by contrast, behaves differently. When you get calcium from natural sources like leafy greens, fish with bones, or legumes, your body absorbs it more slowly. It comes with fiber, fluid, and other nutrients that help the kidneys manage it safely. There's no sudden spike, no overload, no pressure on an already delicate system. Doctors also remind patients that not all calcium-rich supplements are labeled clearly. Some antacids, protein powders, and fortified drinks contain large doses of calcium, which can quietly add up. If multiple products are used together, even without intention, the total calcium intake can quickly exceed what the body, and especially the kidneys, can safely process. Experts stress that seniors need to be empowered with this knowledge. Not afraid, but aware. Because kidney damage from calcium supplements is avoidable. When supplements are used carefully, in the right amounts, and with medical oversight, the risk is greatly reduced. But when they are taken out of habit or assumed to be harmless, they can do lasting harm. The kidneys don't send loud warnings. They work quietly behind the scenes, doing some of the most important work in the entire body. But they are sensitive, and they deserve care, especially after a lifetime of service. If calcium supplements are part of your daily routine, take a moment to consider why. Ask what dose you're taking. Check the labels of other products. Look at how much water you drink. And talk with someone who understands your full health picture. You've worked too hard to build a life of strength, clarity, and independence. Your kidneys are part of what keeps that life moving forward. Protecting them means protecting your future. And that begins with a choice, one that puts knowledge, care, and long-term wellness first. Let this be a reminder that more isn't always better. That even something as familiar as a calcium supplement can have a hidden cost. And that your body, especially now, deserves not just effort, but understanding. You're still learning, still growing, still choosing. And today that choice can begin with giving your kidneys the respect and rest they need.